moving towards obviously how your job has shifted, I guess maybe what has changed, first of all, what looks different about your day since, I don't know, when did things start to change for you, and how has that affected your role?
Well, literally everything is completely different. I still do a lot the same things, but they're now entirely focused on COVID-19. That's it. And I would say I went to visit my mom in Florida. My mom, who used to teach at Central.
Yeah.
In Florida for her birthday on Martin Luther King weekend. And while I was there, so we have a partnership with Wuhan, China, with the medical school in Wuhan, China, and for medical education stuff. And I've been there about 7 times to help work with their students and their teachers and to help them with infection control stuff as well in like 2 of the main hospitals there. And I had seen these reports in mid-January about the pneumonia in Wuhan. And we had sent some communications to our friends and said, what's going on? And we were hearing back about it while I was in Florida that weekend. And it wasn't good. It was bad in a way that, like, if you're experienced in epidemiology, you talk to people and you're like, wait a second. This is not going well at all. And it's not that they were doing something wrong. It's just that when you got to the nitty-gritty details of the virus, it looked bad. Like, it was making people sick in an unpredictable way, suggesting that there was a lot more transmission happening than anybody thought. And it was clear before anybody in China was willing to admit that there was person-to-person spread. It was clear by the 15th of January that there was person-to-person spread, to me anyway. And the asymptomatic, pre-symptomatic spread, when you can spread the virus before you're even sick, is really hard to manage. It's impossible almost to control that without the kind of lockdown measures that we're all seeing. And so when I got back to work on the 21st of January, we said, I think we're going to have to start making sure people haven't been to Wuhan recently. We're in part of a university. People travel back and forth. It's right after the holidays. There certainly are a lot of people traveling to and from China. So we need to make sure that they're not sick when they come here. And we started working on a screening program, and we had contact with public health, and they were right along the same lines as us. And we just started, I think that Tuesday, I went to my clinic in the morning, and by the afternoon, I was working full time that day on COVID, what is now COVID-19. And I have not stopped since then. I think I've had a few days off. But it's been basically nonstop since then.
Are you still meeting patients? Do you interact with patients who have corona or COVID? What is the, protocol?
Well, I don't now, but in the beginning I did. And I was still seeing my patients and doing my regular work, but also sort of mobilizing my team, my infection control team, and saying, we need to start identifying every patient that comes to the hospital that's been to China or been to Wuhan. And then we need to get in touch. We need to get more information. Then, we contact CDC, and these things start coming to us about how to get patients tested if they might have the coronavirus, and what to do. And we're following the news and start talking to people. And about a week in, we said, it's looking kind of bad, right? By then we had a case in the United States, and they had shut down Wuhan. And I can't tell you how I think many people probably haven't been to Wuhan, but to look at videos of the streets of this place that I had been, and these pictures from hospitals that I had stood in those hospitals and seen patients in those hospitals, and to see what was happening was heartbreaking. And it was also terrifying because it was not stoppable. The Chinese they are smart, and they know what they're doing with medicine. This isn't a third world country. If they have to close down Wuhan in order to control this virus, it's a problem. And we knew that, and we knew what the realities were on the ground. And it was, taking a long time for it to sort of be acknowledged by the general public, as it should. I mean, other people shouldn't have worried about it then. It's my job to take care of that. So we got things set in the hospital. We made plans and protocols. This is what we do. If somebody comes in like this is how we test them. This is how we make sure everybody's safe. This is how we identify them. This is what we do if they start to come in, and this is who you call for help, and this is what we're going to do. And then we go through the period where everything changes, because like every day the rules were changing and more people were getting sick from more and more parts of China. And then everybody from China had to be in quarantine. You have to make sure everybody's okay. And then the university needs help, and everybody needs help implementing these rules. And what does it mean? And are we going to be able to have students come and visit? And what are we going to do about this? And what are we going to do about that? And spring break's coming, and is everybody going to go away for spring break? And it gets, there's a lot of questions. And when you are, in a pandemic situation, there aren't that many people with the skills to answer. It's not like we have a big reserve corps of hospital epidemiologists and public health officials to help answer. So I just spend a lot of time answering questions and getting people ready, setting up our hospital emergency. I mean, I think about a week and a half in January still, we set up our emergency operations plan for the hospital and started working on emergency operations.
So in terms of your involvement with the press conference and Governor Pritzker and Mayor Lightfoot, is that something that you have done in the past? Was this a new venue for you? How did you get in contact with them? Can you go into that a little bit?
Yeah, I mean, a few days, we were starting to transition to work from home mostly by then, because we were seeing patients in the hospital, and we had sort of started a lot of social distancing measures inside the hospital in order to protect our staff. And so we were transitioning as much as we could to work from home. And I was working at like 11 o'clock one night still. And I got a call from, I think it was from Christian Mitchell, one of the deputy governors. And he's like, hey, this is Christian Mitchell. I'm a deputy. Oh, no, it wasn't Christian Mitchell. It was somebody else who said they found my name in the lab schools, like a private school associated with the University of Chicago. My son goes to school there. And this guy's like, I found you in the lab directory because I was looking for you. I saw you on a media thing. The governor wants to talk to some hospital epidemiologists that aren't part of the public health system to see what they think about stuff. And then the governor called me. Well, actually, first somebody from his office called and asked me questions about a stay-at-home order. And I was like, we need to do it. We need to do it yesterday. Can we do it now? Please. It's such a good idea. Like it needs to happen. And we talked about it for a little while. And I thought, the governor won't call me. It was just the person from his office. And then a few hours later, the governor called. And I was like, hello. He had talked to a lot of the people in my job, like to do my work at the other major academic medical centers in the city. And we had all, we're all in touch with each other too. And we were all of the unanimous belief that it's the only way to protect our hospitals. And it's not just about protecting the hospitals. It's about protecting the promise of medical care when you need it. Because if you didn't do it, there's no other way to prevent the spread of this, because it's just so insidious and so tricky. And if you don't do it, then people would be turned away. We would have to turn people away from things like oxygen and ventilators. And those are people that would survive. And we saw it happening in other countries. We saw it happening. We knew it firsthand from our friends in Wuhan. And we just can't do that. We're not in America. It's not okay. We need to figure out a way to be able to provide life support for the patients and life support for the economy, because we have the money and the resources to do it. It's just not an option. I get that we don't, like, not everybody's on board for like universal health care, and maybe some of us are more liberal than others of us, but we just can't let people die. We can't stand by and watch somebody die because we didn't feel like doing something to help them. We have laws about that, actually. There's a law called EMTALA, which means that anybody who presents to an emergency department has to be provided stabilization care no matter what. Even if they can't pay and they don't have any way of reimbursing you, and you don't take their insurance, it doesn't matter. You still have to take care of them. and women in labor, same thing. And so there is a fundamental value in America that we should take care of people when they most need us, especially when they can survive. And this was going to break that promise if we didn't do something. So we were all for it. Now I've been very somber. We were all for it. I talked to him, and about 15 minutes in the conversation, he said, well, Emily, would you come and announce this with me? And I had no idea. He wanted somebody who was going to represent, healthcare that wasn't from the government, because it's important to know that this is not a government thing that people wanted to do to oppress the people. And then I said, yeah, I guess I can do that. I mean, you don't say no to the governor, really. So, I mean, unless he's asking you to do something really dangerous or bad, but this is, So I said, yeah. And he's like, well, why don't you write up your remarks and send them to my deputy? And I was like, okay. And I wrote it up. I sent it. I was like, I think this is way too dramatic. And they said, no, this is what we're going for. And I was like, really? Because I think it's really dramatic. And they're like, this is what we need. And I was like, all right, then.
What was your reaction after having heard that it kind of exploded a little bit?
Well, I came home. I mean, I'd been working from home for a little while already, a few days and a week maybe. And I came home and I was like, well, thank goodness that's over. Because I was really nervous about it. I mean, I'm not usually nervous about talking to people, but I felt like telling the whole state, sorry, you got to stay home for a while. It's a little different, right? So, so I was really happy that it was over. And then I started getting calls from media outlets, and the people from the university's media plan were like, you're getting a lot of hits. And I was like, really? For what? So then I just talked to some journalists and did some things. And it seems like it struck a chord with people. It helped them to understand why we needed to do it. It was really important to me to get the message across that this is going to feel like nothing happened if we do it right. And that was the hardest thing for me, because I thought people aren't going to understand when they stay home. They're going to be like, well, this was a waste. Nothing happened. Yeah. When you stay home and then a hurricane doesn't come, one of those. But that's not what this is. It's like, if you stay home, you can make the hurricane not come, which is not how hurricanes work. So in case anybody's watching this who's thinking that, don't think that. But if you stay home, you can make it better. And that's what's happening. And I think it is true. You can save the world a little bit by watching Netflix and sitting on your couch. And it won't feel like very much, but that's the point. We have to do it. We can't think about only ourselves, but we still need our government officials to help bail out some of the economy pieces, because you can't keep running a business and paying everybody if you're not bringing any money in. I mean, that seems somewhat obvious, but that doesn't mean that we don't have a method for helping people. I mean, this is America. We can be resilient. I know that we don't want more debt. I understand that. But we also, if we let a bunch of people die unnecessarily, that is also bad for the economy. Mm-hmm. But it's also bad for humanity. And it makes us feel like we're disconnected, like we don't care about people, and like it doesn't matter when people live or die. And that's not a place that we want to be. I don't think there's any liberal or conservative that really wants to perpetuate that message or that feeling that people's lives are just not important.
So I guess, has your message changed at all since that press conference? Or do you still want people to understand the same thing? Or do you feel like if you had a takeaway, I guess one or two things that if people understood it about this virus, we would be better off as a nation, as a world, what would that be?
We should have been readier. We knew. I mean, I went to tabletop exercises every year about how to deal with the respiratory virus pandemic. And every time it turned out like this. I mean, actually worse than this, because, well, we ended up having stay-at-home orders, and that was the only way that we could get things to be better, right? And I think I think that in all of those, we found out that we didn't communicate with each other enough, that we didn't prepare enough in advance. And I have to say, the things that went differently in those tabletops is that there was a lot more mobilization of supplies earlier on. There was a centralized distribution plan for how we're going to get supplies to the places that needed it most, so that people aren't doing things that are dangerous, like reusing N95 masks that are grossly contaminated, and stuff that is not helping our healthcare workers. There was a lot, I mean, and maybe that was unrealistic in those tabletop exercises. Maybe that's what it is. But I think if I had it to do over again, I would have started the stay-at-home order earlier. I would have had more of a plan for how we could shut down parts of the, like, sort of keep people at home without having to shut down as much of the economy. I would have planned to have, we should have had more PPE in our strategic national stockpile. I would have tested way more people from the very beginning and been way more aggressive. But, you know, those are things that we've learned now. We didn't do them, and now we are where we are. I just hope that we are mindful about the way that we come out of this in such a way that makes it, that we don't make the same mistakes. I mean, I see us really barreling down the road of like, we just can't stand to stay like this anymore because it's nothing, right? Because it feels like nothing. And so then we're like, we got to open back up. And we open back up and the cases are just going to bloom. I mean, what? Like, we estimate that about 5% of the population is going to be immune, and we don't even know how long that immunity is going to last. And so you open everything back up all at once and everything's going to come back again, and we're going to be back in lockdown. The only way to do this is to make essential workplaces safer for workers, the same way that we make the workplace hospital safer for healthcare workers, by using social distancing at work, by using PPE like fabric masks, by limiting the number of people in the hospital at any one time, by having people work from home, by putting masks on individuals that come in, patients that come in for care that they need. Those are the sorts of things that are going to make it safe for our healthcare workers to be at work, and they're in the most high risk situation. And we need to do the same things for people that work at the Trader Joe's. We need to do the same things if we're going to reopen places for you to get a haircut. We need to do it in a way that's going to be safe. And there's ways to do that. If we can do it for healthcare workers that are taking care of COVID patients and they don't get sick, we can find a way to make you be able to get a haircut without getting COVID. And we just need to do it right. And it's going to require way more public health resources, way more contact tracing, way more testing, way more in general care, and still a lot of staying at home.
Mm-hmm. Do you think that's going to start happening gradually? Do you see kind of a light at the end of the tunnel?
We're talking about it a lot, talking about it at the hospital. We're finding ways to get more patients. Patients need to come in for their diabetes care. They need to figure out what's going on with their wound, you know? And so we're figuring it out. I'm talking to the governor about it. We're talking about it with our city. We're talking about it with the state. We're talking about it everywhere. Everybody's talking about it. I'm working with a public policy, the head of the public policy school at University of Chicago, and an endowed chair in economics, Kate Baker and John List, to try and figure out, using mathematical modeling that they use in economics all the time, how to be more precise about what parts of the economy switch on and switch off. This work is important and necessary. It's just as essential as everybody figuring out how to use Zoom, which everyone now knows how to do.
I guess circling back, kind of, if you had to think about this same type of messaging, but towards our high school students, because I think that obviously this is an unprecedented time for everyone, but when you're young and when these like life events are happening, it's a lot to process. So what would you advise them to know about the world around them, how they can help, what they can do to, you know, stay calm, but also be part of the solution?
It's really hard to give up your graduation ceremony. It was really hard. I mean, not to put them on the same level, but it was really hard for my son to give up his science conference thing that he had at school. That was like the big thing that happens in 5th grade, you know, and he's never going to have it. And I'm never going to have the big, massive spring break adventure trip that I was going to take with him this year. And I'm never going to have whatever summer vacation I was going to take with my family, you know. and people are never going to have their graduation, and they're never going to have these. Everybody's having a loss. People are going to lose jobs. People have lost a lot of jobs. People are going to lose loved ones to COVID. We all are paying for this, and it's not fair. But there is not a way to change that. It is what it is. You can't just grab what you want and take it for yourself at the expense of other people's lives. You have to see yourself as part of the bigger world. And that means sometimes we all have to make sacrifices. And you have to see that it's not just you making the sacrifice. We're all making this sacrifice together. Everybody's losing something, but hopefully few of us are losing family members. And that's what matters right now. You're doing these things to save a grandma somewhere. When you decide that you're not going to get together with your friends, or you're going to do it over Zoom instead of doing it in person, even though you're supposed to be a senior in high school and this is supposed to be the time of your life, you're doing it to save a grandma or a mom or a little sister or brother, because there are certainly people who are dying who are young. It's not very many, and probably that wouldn't happen to you or any of you. It's an opportunity for us all to see ourselves as part of something bigger than ourselves. And the more of us that embrace that, the more of us that there will be.